Hello, Dr. Arbeitman here, and the purpose of this video is to give you some very simple balance exercises. If you're noticing dizziness or imbalance, there are many mechanisms in the central nervous system that tell our brain where we are. And one of the reasons why upper cervical care is critical if you're having issues with dizziness or balance is the brain gets 60% of its information about where the body is just from the spinal joints. And a third of that is just from the upper cervical joint. So if this vertebra and this joint isn't aligned or moving properly, the cerebellum, the balance center of the brain, can be getting aberrant information in. So then you have sort of aberrant information coming out. So the upper cervical care is a critical part of getting balance restored. But however, we always know that patients that do active at-home care along with their upper cervical care always get the best results. So I'm going to take you through a progression of exercises that are very simple, and I'm going to show you right now. So the first thing that we're going to do is always make sure we're either close to a wall or close to a counter or close to a chair, something that we can grab so that, we can catch ourselves. So this would be like a perfect setup. And our goal for every exercise is to be able to do it for a minute, but we may have to start out with a 15-second interval and then go to 30 seconds and then go to 45 seconds. So the first exercise is just standing on 2 feet, looking straight ahead, and being able to hold that, eyes open, without wobbling for a minute. Once you can do that, and you may be able to already do that, then we're gonna move towards 1 foot up, knee up like this, for 15 seconds, 30 seconds, 45 seconds, and a minute. And you want to be able to do that on both sides, because when my left knee is up, it's working a different area of my brain than when my right knee is up. So you got to be able to do both. You don't progress to the next exercise until you can do both legs for a minute. And it's okay if you have to, tap, tap, tap. That's just like a little helper. So if you have to touch the counter and tap, this is okay. The next exercise, and again, you want to be close, and if you don't feel safe, then have somebody there spot you. Always be safe. Is eyes closed, both feet on the ground. 15 seconds, 30 seconds. Eventually, you want to get to a minute. We want to do these exercises every day. So you're going to eventually start to see your progress. And once you can, progress from eyes open to eyes closed, you don't have to go back and do eyes open again unless you want to. And then ultimately, what we're going to be working towards, and it can be retrained, is 1 leg open, eyes closed, 15 seconds, 30 seconds, 45 seconds, and 60 seconds. Right now, my ankle is doing this. And again, you're going to want to do both sides, and work towards it. And don't get discouraged. You may notice that it takes a week to go from 15 seconds to 20 seconds. If you have a child at home, give them the iPhone and have them keep track of your time. So that's going to work what we call the proprioceptive system, the information that your brain is getting from your feet, and when you take and your visual field. The reason why closing your eyes makes it so much more difficult is because you're losing those visual cues and you're solely depending on the proprioceptors in your foot. I would actually recommend that you do this you could do this barefoot or in a sneaker, whatever you're more comfortable with. Sneakers are going to give you a little more stability. Having your foot directly on the ground is going to give you a little more perception because you're going to have all your tactile senses, and you could do either one. Then there's the way that the eyes and the brain link up. So I'm going to show you a simple exercise to retrain. It's sort of a visual therapy. So you're going to take 2 sticky notes, and you're going to put A on one or a B and a B on the other, and you're just going to put them up and down. And just moving your eyes, you're going to take your eyes up to the A and down to the B, up to the A and down to the B. Again, we want to do this up to a level of comfort. If you're getting, nauseous or dizzy, then that's your fatigue point. That's when you stop. So it's not about like grinning and bearing it. You work your way up. And if you can go up and down for a minute with just your eyes, that's wonderful. The progression from there, after you do just your eyes, you're going to actually do your head. So we're trying to train the mechanism of first your eyes and then the head. So you're going to do those two together. You're always going to do the eyes first and then the head. Once you finish your ups and downs, you're gonna do your side to sides. And same thing, A and B, my eyes are gonna go left to right, either for 15 seconds, 30 seconds, 45 seconds, or a minute. Once that's done, you're gonna do your head, A to B. And you could start out tight like this, it's gonna make it easier, but you can go as wide as you want. I mean, you can go all the way out here to be tracking left to right, up and down. So you progress yourself by taking it wider. I really hope this helps. If you have questions, bring them along with you on your next visit, and we'll see you soon.